In this study, we've developed an entirely new approach to vaccine development. Now, older approaches to developing vaccines include either using formaldehyde, which was developed back in the 1920s, or BPL, which stands for beta-propiolactone, developed in the 1950s. But these are old approaches, and what we've come up with is an entirely new approach to vaccine development, which involves using hydrogen peroxide to basically oxidize the pathogen of interest. And this is exciting because we're able to maintain the integrity of the virus, and so it acts as a better vaccine, and we get better immunity and better protection. Okay, so we're very fortunate that many of our vaccines, and in fact all of our childhood vaccines, are very, very safe. But some vaccines can be made safer. So for instance, if you are a vulnerable population, for instance infants, elderly, or the immune compromised, there's what's called contraindications to getting certain vaccines. If the vaccine is a live attenuated virus or a weakened virus, if your immune system is also weakened, then that vaccination could be dangerous. In our approach, we're able to actually kill the virus, so it can't grow, it can't attack the person, but the immune system can then recognize it and develop immunity to protect them against the real thing. This could be broadly applicable to many different viruses, different infectious diseases that we either have vaccines for that don't work well enough, or in some cases we don't have any vaccine at all to use. And so we think that this approach could be used to develop new and improved vaccines against new targets. Or we can improve vaccines against current targets. It would be always better to have a better flu vaccine. It would be better to have a better yellow fever vaccine. There's no vaccine against dengue that's currently available, and that's a huge problem worldwide. And so we think that we can take this approach and develop better vaccines for these very important targets. What we're doing now is finishing up our preclinical studies on a couple different vaccine targets, and we've now begun GMP manufacturing of vaccine material that we'll use as clinical grade vaccine that will go into human subjects. And we're developing vaccines right here, right now in Oregon for yellow fever and for West Nile virus.